All right. So, hello, everybody. Great to see you. And thanks for taking the time today to learn about Measure ER. Why don't we go to the next slide? Great. So, I'm going to walk through some background, and then Darren's going to talk through the measure, and then we'll probably do some back and forth on some of the elements of the measure when it comes to school health. But general background is we're looking at a healthcare crisis, and this should not be news to anyone here, but we know that both our county, Department of Public Health, other departments, as well as our community health centers and other partners have all lost federal grants. We've had grants canceled. Some of us got doged last year. That is a verb. And when for those of us that continue to have federal grants, we've been told repeated times that they can all be canceled for convenience, not just for cause. So anyone who relies on federal funding is on pins and needles. Additionally, with HR 1, we know that starting in July of last year, our Planned Parenthoods, by the way, so community health centers in LA County, including the Planned Parenthoods, serve 2.18 million patients a year. 10% of them are served by our Planned Parenthoods. So them being barred from Medicaid impacts a key sector of our safety net system. We know that coming up in January, we were staring down the barrel of the largest healthcare cuts in federal history. They've been on a growth path, and now we're on the opposite. We've got work requirements and 6 month redetermination coming in for people who are part of the Affordable Care Act expansion. Additionally, there's a lot of changes happening at the state level for people who don't have satisfactory immigration, or let's say their immigration status prevents them from having federal funds match for the programs that they're in. These could be folks with DACA, these could be student visa holders, U visa holders, um, temporary protected status, and folks without satisfactory documentation. So the state has frozen in adults from if you're not in the Health for All expansion, didn't get in, you're not coming in as of January this year. And additionally, starting what day is today? In a month and a half, adults in the Medi-Cal program from the Health for All expansion are slated to lose their dental benefits as well. On top of that, I want to connect that to the arrow right before. Those folks are also going to have to deal with the 6 month redetermination that's going to be happening because of HR 1. So we're going to just see this huge amount of folks trying, hopefully, to stay on coverage. And it's going to be really challenging. So, similarly, in 6 weeks, the community health centers are slated to lose their payment system for the Health for All expansion population. That's $1 billion. Well, the state calls it savings, we call it cuts, but it's $1 billion statewide annually in losses for the health centers. We estimate for here in LA, it's going to be 400 million a year that our members will lose in just Medi-Cal reimbursement. And that doesn't take into account all of the other things that are impacting the safety net. And then on top of that, is there's also changes coming up for eligibility for certain immigrant groups that are going to be taking place as well. This is not an exhaustive list of all the changes that are coming to put us in this crisis situation, but the full list is exhausting, so we're not going to make you go through that whole thing. But we are living in a terrifying time. We know 7 out of 13 of our public health clinics have already closed. LADHS. Well, actually, let's go to the next slide. I'll tell you what it looks like for the county and the clinics. So we know that a third of LA County is on Medi-Cal, and a third of the people on Medi-Cal um, are could lose coverage by 2028. We are looking at, according to UC Berkeley Labor Center, major losses in LA County's coverage of Medi-Cal. So lots of folks coming in uninsured. Next slide. And so for the LA County on the public side of things, they're looking at 2.4 billion over 3 years in losses. LA's health services is looking at just at 600 million a year, just them. As I mentioned, Department of Public Health has already eliminated 7 out of 13 clinics, and they more cuts are coming. And I will say we're going to talk about Measure ER, uh, but by the time Measure ER gets implemented, more cuts could happen before then because there is crisis happening now. And there's about 5,000 staff that the county projects that it will have to eliminate their positions. So for the clinics, we're looking at about a third or more of their revenue for the federally qualified health centers. For the Planned Parenthoods, they lost the payment system for 75 to 85% of their patients. Um, and the I mentioned the $400 million a year cut just from those the change reimbursement for the health for all population. And on top of that, when people come in uninsured, they can be seen on the sliding fee scale, which slides to zero. So if you're living in extreme poverty, you'll get your care for $0, and the clinic will have to figure out how to cover the cost of that care. So this is the crisis that we find ourselves in, what I refer to as the timeline of terror, because every month there's something terrible that we're looking at. Next slide. So I'll hand it off to Darryn to talk about the solution, which is Measure ER.
Great, Luis. You would think that so many years after doing these Zooms, you would know how to unmute yourself when it's your turn to speak. Good afternoon, everybody. Darryn Harris. I'm the Chief of Government Affairs, Community Relations at St. John's Community Health. And so I just want to, before going into Measure ER, I just want to just take some time just to break down what this means for the folks within the room, for our students, for our families, and for the communities that we serve every single day. As Luis was, talking about, when we talk about custom Medi-Cal, custom reimbursement, clinic instability and reduced access to care, those are not abstract policy changes. They show up in real ways in our school communities as well. They show up when a student has a health issue that goes untreated. They show up when a young person cannot access behavioral health support early enough. They show up when families have even harder time navigating care and when schools are asked to absorb the consequences of fraying healthcare safety net. And so when we were thinking about Measure ER, and we'll talk about it in a second, that's why school-based health mattered so much for this piece of policy, because we saw that school-based health is not separate from the safety net, but in fact, it's one of the clearest and most important expressions of it. For many students, especially low-income students and students for families already facing barriers to care, school-linked and school-based health centers are the most accessible point of entry for our healthcare center. And we see that at St. John's every day through our school-based health centers, how students actually have that access point right there on their campus. But that's not only just for their students, but that the families actually, take advantage of those services as well. And this is more than just a single clinic visit. As you all know, within our school-based health centers, we include primary care, behavioral health, case management, health education, and other supports that help students stay healthy, stay stable, and stay engaged in school. So when we got around to Measure ER, especially for this audience, it included a spending plan. To where there was a set aside for 4% for school-based health centers. For
And
pro
let's advance a couple slides.
Oh,
Um,
I'm all over the
that's okay. No, so just we'll go to, I think the next slide is actually, no, 2 slides further is a spending plan. There
Oh,
you go.
well, I don't have to go to the spending plan right now. We can go back. We
Oh,
go in your order, Luis. My
this is what
apologies.
happens when we're collaborating in the moment. Um, but
But I
let's
could
just
talk.
talk about the
I'll
spending
talk.
plan since it's up right now when you started it. Let's talk about that.
Well, great. Well, you kick it off, Luis. You know about the 45%. You've been building the policy and the program, and you can explain it.
Yeah.
And you were around from
Well,
My
I
Health
think
LA. Oh,
for those of us that go back to public-private partnership, Healthy Way LA, My Health LA, and the history of indigent care programs in LA County, the 45% of the funds. So the Board of Supervisors, there's an earlier slide. I'll just say there's components to this. The Board of Supervisors pass a spending plan as well as a motion to put everything on, to put this on the ballot. So when you read the ballot, it's pretty concise, right? The spending plan is much more specific, which we'll get into. There's also a report back function where the we're going to be going back to the board and reporting to them on what's happening with the development of these programs. At the same time, this week, right now, we're pushing a legislative fix in Sacramento because the voters, if they pass Measure ER and we don't get this bill up in Sacramento passed, nothing happens. You have to have both things happens. Both things happen in order for this to take place. Next slide. There's built-in a 9-member Citizens Oversight Committee. I won't belabor this, but it's appointed by the Board of Supervisors, and they oversee the spending plan. There's public reporting. It's really, I think the key thing in here is that want to make it clear the dollars will go to where the dollars are supposed to go. There's an agreement by the county supervisors, and they're going to have to vote if that changes. There's transparency in how the funds are spent, and there's oversight. So the next slide. And here are the pots of funding. Um, as mentioned, there's a chunk for an uninsured program for the people that used to be that are on Health for All now. If they fall off the program they used to be on, we're resurrecting that until we can get a better outcome at the state and federal level so that these folks have a place to land and continue to get care and coverage. There's also a lot of pots to backfill losses that Department of Health Services has experienced, Department of Public Health, LA County, Pasadena, and Long Beach. The Planned Parenthoods, as I mentioned, so there's a chunk of funds for them to offset the losses that they've had due to HR1. There's a 4% for school-based needs. There's 3% related to supporting enrollment and retention in Medi-Cal, as well as there's 2.5% for IHSS and correctional health services each. But want to make sure we talk about the school-based health needs and programs. So if you'll go to the next slide. So Darryn, you want to dig into this?
Sure. And I'm sorry for jumping the gun, you all.
It's all right.
I wanted to get to the meat, of the presentation. But I mean, as I mentioned before, there is 4% that is set aside, for school-based health needs and programs, which is estimated at roughly $38 million a year. And so this matters because at a time when federal and state decisions are putting more strain on clinics, because these are compound effects. It's not just HR1, but the state of California is also putting a strain, on clinics, public health and family coverage. Measure ER creates a chance for Los Angeles County to protect parts of the healthcare infrastructure that students rely on. And so for me, this is not only a healthcare measure, it's also a measure about whether we are willing to protect the systems that help students learn, families function, and communities stay well. So next slide.
And I'll go in here. So as we think about like that text that you saw was pretty brief, right? When describing school-based health needs, as directed by the Board of Governors of LA Care Health Plan. Folks know LA Care has a grant-making function. They are a public entity. Their Board of Governors is appointed by the County Board of Supervisors and nominated from different key stakeholder groups, like the community health centers. We have 2 seats on that board, the hospitals, the county, the supervisors, private physicians, there's, highly represented. And what I appreciate about ER is that we're not building something new here. We are looking at what's been lost and saying we are shovel ready for these investments. So we already have definitions from the federal government, from HRSA, on what a school-based health center is. We already have a definition for the California School-Based Health Alliance of what a school-based health center is. We have models of different grants that have been given out at the federal level for school-based health needs. So it does not involve a reinventing of the wheel. So the piece is just here about using a grant making entity to make grants, about 38 million a year, to school-based health centers. So these definitions, I think you're all fairly familiar with them, but I think the beauty of this here is this isn't, I think that our voters in LA have been burned in the past by measures where we're promising to build things, to create new buildings, new housing, new this. This is about healthcare. This is about a shovel-ready system that, we've got all of these school-based health centers in existence. What can we do to support them? What can we do to keep them open, keep them operating, and improve their services? As uh, yeah, so to improve the services. So as we know, the community health centers that run these school-based health centers are going to be really taxed because of HR1. And so helping the school-based health centers will help the health centers as well. Next slide. Darren.
So this is a growing, coalition, as I mentioned. This is really about protecting the safety net. And as you can see here, um, every sector of the healthcare um, system has endorsed this measure. Whether we're talking about community clinics, Planned Parenthood, the hospitals, the private doctors, labor, the hospital association, um, everybody has pretty much come together and said this is the right thing to do. And so I'll just spend a few moments just talking about where we're at right now with the campaign with all of our different partners. Um, because at its core, this is a very local response to a very real crisis. And so all Measure ER gives is LA County voters the opportunity to act locally to protect those essential services that I mentioned before. As from a campaign standpoint, our argument is very straightforward. This is about preserving access to care, protecting the safety net, and making sure that LA County is not left without the tools to respond and take these cuts to hold on to what we have right now. And so on polling, what we're seeing is we did a few polls within the field. We're still within the margin of victory in order to get this thing over the finish line. But we know that our campaign's challenge right now is to keep connecting the measure to real life impacts. And so it's about getting our message out there, which is where you all will be so extremely helpful. Where we could continue to talk about access to care, talk about overcrowded emergency systems, talk about support for clinics, public health, and schools, support for our school-based health infrastructure that students and families rely on. And so over the next, 3 weeks, mail will continue to drop to different, voters within the county, because this is a countywide measure. But for the folks that you do have reached to, we are asking that you just share the good news, talk about what school-based health centers and what students need and what would happen, if they were to lose that. So folks will really have a good understanding about what's at stake here.
And that's, I mean, that's the gist of it. We want to make sure we give as much time as possible for questions, for discussion, for thoughts, feedback, and input that you may have. And so wanted to just provide some high levels on the initiative itself. And then, and I'll put this in the chat. Okay, did I get that right? Oh, yeah. So welcome to any questions you might have.
Thank you both. I appreciate that. I'd like to kick us off with a kind of a big main question here is this all this money is going to come from a sales tax, right? So can you explain like how did you land on a sales tax and exactly how does that work?
So this is after a lot of discussion. Let's be clear, sales taxes are regressive, right? We know this, that sales taxes impact low-income communities more than high-income communities. But know what's more regressive than a sales tax? HR1, because it absolutely targets low-income communities. We don't really have a lot of tools in our toolbox here in LA when it comes to making revenue. We just
Oh,
don't. And we needed to get something on the June ballot, not November, because November is going to be a hot mess. There's so many candidates, so many different statewide ballot measures, and it'll be really, really hard to get attention from anyone to vote for this in November. So we needed something that we could get on in June that the county supervisors would put on the ballot so that our campaign didn't have to spend more millions of dollars to raise to get signatures. So it really that was essential. There's not a lot of other tools in our toolbox as far as this is concerned. I will say it is a half a penny on the dollar. So uh, it is a very it will raise a lot of money, but it is a very small tax and it's on non-essential goods. So this is not on your groceries. This is not on your medications. I saw someone else had their hand up.
Oh, yeah, I thank you so much, Louise and Darren. Two questions. One is something flew by about how we also need something to happen at the
Mhm.
state legislative level for this to go through. And I missed what that was. And then I'm also interested if you have this information on what other areas of California are doing to offset this deluge.
Yeah, so I just put the bill number in the chat. It's AB 1768 by Assembly Member Isaac Bryan. And so this bill, it's now for both us and Contra Costa County, because they are also trying to do a similar thing. Some other counties are looking at this but for their November ballots. So our two counties are banded together on 1768 by Isaac Bryan, because it urgently needs to get passed in the next month, by by mid-June, in order for the voters vote on the tax in June, the bill passes, which allows us to implement the tax, and then the funds start being coming in October. So that's the bill, AB 1768 by Assemblymember Isaac Bryan. It is supposed to go up on the floor today, and it is a squeaker. And I know I see someone from a supervisorial office on the line, and I know that her boss has been reaching out to assembly members in her district and saying, you got to vote for this because it's absolutely critical. Um, cities are opposing this. It's not all cities, some cities. Long Beach supports it, others do support it, but smaller cities like Commerce, some of the contract cities, they oppose it because they want to implement their own taxes, and they're worried about affordability, and that people will go elsewhere to shop. Um, Darren, other things, other
I
comments
would
on that?
just say that, LA County is not the only county that is considering this move, given the stress that we're all under. This election cycle is Contra Costa in LA County, and this is why we have AB 1768. Back in November, Santa Clara County, led and passed a similar measure to backfill a lot of their cuts. In November 2025. And this November, we're expecting, almost a slew of other counties to do this in order to, hold the line, until we can find some stability with the federal and state, funding systems for our healthcare.
And when would the tax be in place? And it's also temporary, right? So when would it be repealed?
Yeah, this is a temporary measure just for 5 years. So this would be until 2031, which has helped tremendously with polling with the voters, in addition to the oversight advisory commission and also the independent audit.
Mhm. Oh, and when it passes in June, it gets implemented in October. So that's when the dollars start flowing. So which means we are actively, in addition to trying to pass, in addition to working to get this passed, I'm not going to say try, working to get this passed, we're also on the back end doing program planning so that we are ready to roll as soon as the funds start coming in. Because the voters, LA voters need to see that we're accountable to them and delivering on the promise of this measure, that they see services, that they see funds going out, that we are able to report on what's happening. So October funds come in, and we're hoping that we can get the dollars out in the winter. Because the county, I'm sorry, they don't really move that fast. So we're trying.
Other questions? I did have a
Oh,
question on
someone's asking how you can help. Did I
Mhm.
hear someone ask how can you help? Um, so, what you can do, if it's in your personal role, if your professional role does not allow you to do some of these things, you can go to yesoner.la. You can sign on to become part of of the coalition. You can also go onto social media and just put the Instagram in the chat. You can go on there right now, and you can follow us on Instagram. You can follow us on Facebook. You can share the posts and try to get the word out. Even though there's not as much on the ballot for this June election, it's still, we are a little campaign compared to billionaires who are running for governor. So it's hard to get airtime. So if what you can do, you can talk to your neighbors, you can talk to your colleagues, talk to your friends, family, whomever. You can follow the social media, you can share the posts. As Darren said, it's polling well, but it's not a guarantee. This is absolutely not a guarantee. And we need to get as much audience and eyes on this as possible.
And it's polling well once folks hear our message. So if you all can help amplify the message, it will get us there.
Great. So a question about the resurrecting kind of the My Health LA aspect. I know that in addition to the HR1 actually cutting people off healthcare, the other, of course, is the chilling effect of people just not wanting to get healthcare. So maybe just from your experience, Louise, when My Health LA was a thing, how how do you think that uptake is going to go given the current context among immigrant communities, and what also can we do there to help support when this does pass?
My Health LA, it's funny, we were having this conversation earlier with yesterday and today with some of our folks. Well, someone said, "Oh, do we have to call it My Health LA? Can't we have something that's more, like Health Options LA? Then it's Hola, great." But people don't know what that is. People know what My Health LA is. So there's already name recognition. And so it's a program that they were on before they got on the Medi-Cal. So that, and it's being provided by the community providers that they trust. There will need to be an outreach campaign to get folks. We're looking at the oh, my brain just went sideways. We're looking at faith community, other folks, consumer advocates that can help with outreach to make sure folks know about this program. If they're eligible for Medi-Cal, we're going to do everything we can to get them on Medi-Cal, because Medi-Cal is better. The specialty access is better. You get hospitalization. There's more benefits in Medi-Cal. And it's not going to be just the health for all population that falls off coverage. It's going to be the people who the paperwork requirements kick off of coverage too. And so this will be a program that will catch them for a time as we work to get them back onto the programs they're eligible. This is a program of last resort. And we want to make sure that we get people enrolled and into any program for which they're eligible and especially if the benefits are greater. And that's why it's the clinics like at St. John's, they've got all these enrollment navigators, all these people who help folks get enrolled and stay enrolled. And they're the ones who are explaining, the ins and outs of all of this. So, and they're going to be, working through that. It's a lift. There's no doubt about it.
I think school-based health centers can definitely be an asset there. I know that we've done some research to show that even through the immigration raids, student access to healthcare centers pretty much remain consistent
Hmm.
because that trust is there, that access is there, they're already on campus.
Hmm.
The parents don't necessarily need to go to a different location. So hopefully through the students and through the schools can also be an access point.
Hmm.
All right, any other questions? I think not.
Wow, I think we answered everyone's questions, or they're actually on social media right now,
So
subscribing and
cool.
following to our Instagram and our Facebook and sharing those posts and telling their friends right now.
Perfect.
Absolutely.
Well, thank you, Darryn and Louise. I really appreciate it. And yeah, we'll follow up with some more information and let's hope this gets passed.
Awesome. Thanks so much.
Thank you
Appreciate
all.
the invite.
Bye. Take care, everyone.